Welcome to Pet Living. Our topic today is canine separation anxiety, and Dr. Lisa Radosta of Florida Veterinary Behavior Service joins me for a short Q&A. Important to know, Dr. Radosta is a board-certified veterinary behaviorist with extensive experience treating dogs with separation anxiety. Welcome, Dr. Radosta.
Thank you for having me. I'm really glad to be talking about this topic right now.
Excellent, excellent. So my first question for you is, how do I know, if it's me that I'm concerned about, how do I know that my dog has separation anxiety?
Well, so I'm going to just make a little adjustment and call it a separation-related disorder, because anyone who is reading textbooks or talking to their vet might hear their vet say separation distress. For a pet parent, the bottom line is that your dog gets upset when you leave. So the early signs are following you to the door, looking depressed as you start to get ready. That might be taking a shower, curling your hair, getting your coffee mug, your travel coffee mug in particular. So all those signs, your dog should be noticing them, but really not changing his emotional state. Many of us have cameras. I have cameras in my house, and I think most of my clients have them too. So you can watch your dog. Your dog should basically be sleeping. He might sleep on the couch for an hour and then go to sleep on your bed for an hour, but he should basically be sleeping. He shouldn't be whining, pacing, panting, crying, or barking. So we're looking for those early signs that you see when you're home, but we're also really wanting you to watch your dog when you're not home to make sure that he's doing what dogs do, which is hanging out.
Great point. So let's say our dog we're watching them from work, or watching them on the camera, and they are panting or pacing or whining. What's happening in their brain?
Well, what's happening is a panic response. And I want to separate this from that rational thought that happens in the forebrain. The thought that, that's the part of the brain that helps me do math or calculus. And we're going to now think about that part of the brain that's emotional. And there's a release of neurochemicals in the brain that affects neurochemicals in the rest of the body and hormones. It's a big cascade of events during a panic attack. So once the dog mounts that stress response, and it might be minor for one dog, it might be extraordinary for another dog, there's a continuum, then we know that the body is physiologically activated. And I want to say that can't be endured on a chronic basis and have the pet continue to be healthy. We have to adjust that for overall health.
And before I ask you how we address that, is there something that we, as their owners or caretakers, is there something that we're doing wrong?
Oh, I love that question. I'm so glad you asked that question, because you and I know each other, and you know that I'm the first one to say it's not about you. Because most of my clients have had dogs for 40 years, and this is the first dog with separation anxiety. The things that go into developing any separation-related disorder are going to be, number one, DNA of the dog. Same reason I'm only 5 feet tall, same reason that, your eyes are the color they are. DNA has a big effect on the dog that you have living in your home with you. Next, events in the dog's life, rehoming, going through a shelter. Dogs attach to us, and that's really traumatic for them to be separated suddenly from an attachment figure. So probably nothing that you're doing. However, you are not the cause of the problem, but you are the solution to the problem. And there's tons that you can do.
And so that leads perfectly into, how do I get my dog help?
Right. So the first thing you want to do is go to your veterinarian. And I know some people are saying, look, my dog's healthy. He looks healthy. He's not limping. He's eating, he's drinking, he's peeing and pooping. He's good. Go to your vet, because dogs are voiceless. They cannot tell us when they hurt. And I am a helicopter mom for my precious angel, my Labrador Retriever Maverick. And so I do blood work probably more than the average person. I do listen to his heart more than the average person. And I find stuff, right? So go to your vet, assess for pain, ask for that physical exam. Next, do simple things at your house. Make your departures and returns low key. It's not a big deal. Bye, out the door. Make your departures fun. Now, I know everybody's read this online, but I want them to do it correctly.
Okay.
Start to make the departure fun before your dog gets upset. That's the key. So let's say that I choose for Maverick a Kong toy with canned food in it. I'm going to give that to him before or just at the point where he notices I'm getting ready. Okay. That's where those signs we talked about before are so important. If it's curling your hair, then the Kong toy goes out prior to the hair getting curled. Okay. And then you might need to give 2 or 3 of those to get him all the way through. Teach your dog independence. It is lovely that he follows you, but when a dog follows you everywhere, that's pathologic. That's not love. So we want to work on mat work. Stay on the mat, enjoy your chew bone, and I'm going to walk around the house. When you follow me, I'm not going to pay you any attention. When you stay on your mat, I'll hang out with you. Simple things like that can help our dogs to feel really comfortable when we're not home.
Now, do those things help dogs that have a severe condition of separation anxiety? Or I know there's a layered approach probably that you can discuss, but are we going to be needing to do those things regardless of the level of severity of separation anxiety?
That's an important question, and I'll backtrack again and say every dog needs those things. Yeah. Regardless, every dog needs to know that when you leave, it's great. It's playtime. It's Disneyland for him. However, even the most severe dog can benefit from these basic foundational tools. Now, the more severe dogs will need additional treatment. They're probably going to need a medication. They may need to have one of those cool new CC loops that we see out there that can help, we think, potentially with separation anxiety. They probably will need more behavioral treatment than the mildly effective dog. So you're right, layering is the perfect way to describe what we're doing. We're starting with the basics and we're layering on what each individual patient needs.
Excellent. So is separation anxiety ultimately curable?
Oh, that's such a good question. Curable. Does that mean that the dog never shows those signs again, even without medication and any work? I'm going to go with no. I'm going to say that it is treatable to the point where it's almost invisible. In other words, if I keep on those medications and I keep up my behavior change and I keep up my dog's behavioral treatments, which are on maintenance, it's not like it's a lot of work every day, then it will never rear its ugly head again. Yeah.
Yeah. Terrific. Well, this has been really helpful to a lot of folks who may be struggling with a dog that has separation anxiety. Where would you recommend that they go to for more credible, reliable information?
Yeah, I would direct them to our website. Our website, flvetbehavior.com, is a grouping of good stuff that we've written, but also good stuff that other people have written. They can go to our Diplomate website, dacvb.org, and that it has handouts for them as well that they can look at. And always they can email through that site, through the dacvb.org site, for help to try to find a veterinary behaviorist.
Terrific. Well, thank you so much for your time today, Dr. Radosta.
Thanks for having me.